Welcome to the Dana and Dr. Pearl Show, where we tackle issues that affect homebound seniors. I'm Dr. Cheryl Pearl, a home care physician, and I've been doing home visits for more than 25 years.
And I'm Dana Arnone. I've been a registered nurse with a focus on home care for over 30 years. In today's show, we'll be discussing low-income senior housing and reverse mortgages. Our guest today is Gwen O'Shea. She's president and CEO of Community Development Corporation of Long Island.
And in our Ask Dana segment, we answer your most commonly asked questions. Dana, what do you think about reverse mortgages for our seniors?
I'm a firm believer in reverse mortgages for people to keep their loved ones safe at home. I'm a firm believer in pulling equity out of the house to keep their loved ones safe at home.
I agree with you.
I know you do. So I think
because I feel like at some point your kids have to get up and make their own living, and that's your money.
Well, they think of it as their retirement fund, but it's not the retirement fund. It is, it is the fund to help house your loved one at home. So I'm interested to hear what Gwen has to say about reverse mortgages and how we can maybe share some of that information with families in the community. Maybe there's some things that they weren't really thinking about, but like I say, if you want your family member home, they want to be home, they deserve to be home, you're going to have to look at sometimes pulling some equity out of the house.
I actually wish that we had more low-income housing available for our seniors. Mm-hmm. There's just not enough, mm-hmm. and there is a long wait mm-hmm. for people who want that housing. The other issue, of course, with the housing is you need to take a look whether someone's on ground or one level up and mm-hmm. how they're accessing those upper levels. So even though if one becomes available, it has to be accessible.
Right. I know when we were looking to sell my mother-in-law's home, she had a large split level in Massapequa Park. It was time for her to go, so we put her on the list. She was lucky enough to get into a senior housing in the local area, but she didn't want to be on the floor, the bottom. She wanted to be up on top because she didn't want someone above her. Oh. So when we got her the stair glide, and she worked out fine. She lived there till she was 95 years old.
We need to take a break. Coming up after the break, we'll speak with Gwen O'Shea, resident and CEO of the Community Development Corporation of Long Island. We'll be right back.
Hi, welcome back to the Dana and Dr. Pearl Show. Today we're discussing low-income senior housing and reverse mortgages. Joining me to shed some light on this topic is Gwen O'Shea. She is president and CEO of the Community Development Corporation of Long Island. Hi, Gwen. How are you?
I am good. How are you? Thank you so much for having me.
I am so. This topic is actually very interesting to me because I've lived it throughout my life, and so I'm really happy and excited to give people some information that I'm sure that they've been wondering about. So today we're going to discuss low-income senior housing and reverse mortgages. So let's start off by saying, what is exactly the Community Development Corporation of Long Island? What is that?
Sure. So we like to say that we're one of the best kept secrets here on Long Island.
Sounds like you are.
Or otherwise known as the other CDC. There's a lot of conversation around CDC right now,
yeah.
But we're Community Development Corporation
not
of
the
Long
same,
Island.
though.
Yeah, definitely not the same. We've been serving Nassau and Suffolk counties for 52 years, and actually in the past decade have also expanded to support Queens and Brooklyn counties as well. And we are all things home. So we are all about
all things
how do
home.
we
I like that.
You like that?
I do.
So we're about, really supporting individuals and communities, making sure that they can be safe in a home that they define it and have the financial supports to be successful in that home and in the community overall.
So basically, do people call you for information or do you give funding? Like exactly how do you help them?
So we help individuals through a variety of different ways. We are available through our website always. In particular now in COVID, we're doing a lot more online. We're doing a lot more through Zoom. But based on some of our programs, like our home improvement programs and some of our weatherization programs, we do go on site to individuals' homes if they are comfortable. Right now, having us on site, we practice great social distancing and really making sure we're respecting people's space and health issues. But we can connect with individuals in a variety of different ways.
So assessing affordable housing, I know with my experience with my mother-in-law, that was a big concern for her and for us. So she lived in a split-level home in Massapequa Park. The house was paid off, the mortgage was paid off, but the taxes were still there. The electric was still a problem. The dollars spent on maintaining the home was becoming out of her reach. And then we thought, well, where's she going to live? She's not a nursing home patient. She definitely, you would not want her in an assisted living. Let me put it that way. But but she was a very independent female. You know, she was 87 years old. She was nowhere going anywhere in housing that would be congregate at all. And finding a place that suited her, you know, her personality, where she wanted to be, local to the shopping, local to her family, was something that we, you know, struggled with. That's why she stayed in the house for a little bit longer than she probably should have. And then the Seasons of Massapequa opened up, and we were able to get her on that list, and she was able to purchase there. I'm sure that comes up a lot for families. So what is one way that you help guide them?
Yeah, it's a really good point, and it's an issue that, just based on our population, when we take a look at Nassau and Suffolk County and see, you know, we're one of the oldest suburbs in the country. We have lots of individuals here that are in the senior age category now and are living longer. And many individuals want to stay here. It's been their home. Long Island has been their home their whole life, and they want to figure out how to stay put. And it's certainly a challenge, right? You bring up a scenario, which is a great one. Your mother-in-law had a great support. She had you, she had your husband, and she had the whole family looking at what makes the most sense for her, right? So that's one option. But we also know, unfortunately, for so many seniors on Long Island, they don't have that. You know, they're on their own, and they're trying to navigate, and that's where we come into play. And I really appreciate you having us on to be able to spread the word out to a broader group of people, because so often so many people, you know, they've worked so hard their whole life, they don't want to take assistance, and they think somehow that what we're doing to help them be safe and support their home is a handout, when it's not. So we really encourage all individuals to recognize that they have a right to stay in a safe home. So calling us gives them an opportunity to have our team come take a look at the house. Can we do home improvements? Can we do weatherization? And then there's the other issue that you brought up, which is all of us taking a look at how do we help support additional development opportunities in our community. Because we know we want our family members to stay close. We know we want them to be able to afford where they live. But that takes the community working with the towns, the town boards, the community groups to really say we need to look at other sort of housing options, not just single family homes, to allow people to stay here, to age here, and to do it in a way that's affordable and safe.
Yeah. See, my family lives in Virginia, and it's funny because when my grandmother was alive and she wanted to stay near my mom, but we knew that she was gonna, you know, she was older, but she wanted her independence. So down in Virginia, I always had hope. I know there's one place that does this here, but it would be so nice to be able to have your apartment. You need a little bit of help. Move next door. Okay, it's an assisted living. Have a little bit more help. Oh, you need more help. Okay, go to the nursing home. And that's what Virginia and Ohio both have it. And my grandmother lived in both scenarios, so she didn't have to. Her address didn't change. You know, just
Right.
a little bit of a location change. I know they have something like that in Port Washington. Is there any other ones like that? Like, to me, that's ideal.
Yeah, no, it's a really good point. It's the whole idea of aging in place, right? There are a couple other properties we know out east. In Greenport, Peconic Landing has a very similar.
That's where I'm going. I'm going there.
It's beautiful. I mean, it's on the water, and it has sort of the phase in. But there are other ways that we can get at that too. For example, you know, taking your mother-in-law's house, had we had better permitting processes and ways in which allowances for people to build accessory housing, so that if you have a large home, you can build an apartment unit that you could either move into if you wanted, or have someone live there to make sure you're not isolated. There's someone that's able to check in on you and have that be affordable.
That's a good idea.
So we help support people that are working in the community, living in the community. And you know, you bring up such an important point, which is so many seniors are on fixed incomes, but all the other costs keep going up, whether it's taxes or it's utilities or it's food costs. We've got to figure out a way to help people be able to stay safe in their homes, and having accessory apartments is one way to get at that without building. Not every community needs a 50-unit development, right? So the developments you brought up of like phase in.
We just had another family that was removing their loved one from a nursing home, not because of care, not because of anything other than they can't get to the mother. They want to see their mother. So they chose to bring them home. And I'm sure that after COVID is resolved, more people are going to probably think about how am I going to keep mom near me or close to me, other than, I guess what you're talking about is a different version of a mother-daughter scenario?
That works in communities where there's space, where there's land to do that. In other areas, we need to create housing too, but to do it in a way that really respects the facade and the community can be by creating additional accessory housing. If we had municipalities and towns that had sort of a template that they could use it, and Suffolk County has done a great job creating this to help incentivize some of their municipalities, so towns can say, okay, this is what we need to see at a home to make sure the square footage is appropriate, so we know somebody is safe, that there's sewer and water connectivity, so that we're not causing additional burden, you know, to the municipality as a whole. And by doing that, we can create additional housing opportunities. The other piece, which is why I'm glad to be here, is that we as an organization also provide support from lending and grants to help individuals that are looking at their home right now, that have been there a lot more because COVID is keeping people put, and saying like, eek, I really need to redo my roof. I really need to do, fix this bathroom or redo my kitchen because I'm going to be having a new family member here. So people can call us and really access capital in a very cost-effective way to, again, make sure that their home is safe and healthy for them and their family members.
Is there a income bracket that they have to stay within?
So that's a really good question. We have, CDCLI has a variety of different programs, from access to home to the home improvement program to weatherization, and there are variations in income. And so I have a tendency to kind of get into the weeds in a lot of numbers, so I'll spare the numbers, but what I will say is that we know pre-COVID, over half of Long Islanders qualified for some of our programs. That was pre-COVID. So I strongly encourage, in particular when we're talking about the senior population, those that may be on their own or those that may be struggling financially, they're very likely to qualify for some of the supports that we have available.
So Gwen, I know that this is a topic that I find very interesting, and I'm sure that there's a lot of people that would like to learn more information from you and about the organization. How do they access you other than maybe just the website?
So people can call us. Our direct line is 631-471-1215. We have a very diverse cross-section of staff members that are able to speak different languages, come from different backgrounds, and able to support the communities that we know we serve here on Long Island. So individuals should feel comfortable to call us. They can peruse the website to take a look at some of the documents. Sometimes I know that's very overwhelming for people when you start talking, government jargon about eligibility and policies. Sometimes people almost want to throw their hands up and say, I don't get it, so I don't want to do it. But I really strongly encourage people to call us.
What's that website?
It's www.cdcli.org.
Perfect. And the 631 number services Nassau as well.
That's correct.
Thank you, Gwen. You made a challenging topic much more understandable. I know you're going to come back in a few minutes. We're going to discuss reverse mortgages. So stay tuned. Coming up next is Ask Dana. We'll be right back. Welcome back to the Dana Dr. Pearl Show. It's time for Ask Dana. We've received many questions this week through our allthingshomecare.org, and we'd like to answer some of those questions for you now. My mom prefers more me time, so we've decided she will try to age in place at home. Do you think that that's okay, even though she may be home alone frequently? The first thing that we always talk to families about is safety. Is she able to stay by herself? If so, then I always say that home is the best place for them. But you have to make sure that it's safety. If you have any questions about home safety issues, you can always give us a call and we can help set somebody up into the home to assess the safetiness of the house. Are there volunteer opportunities my parent can do from home? There are some opportunities for seniors to help out and volunteer. They can do some phone calls. They have friendly visiting types of volunteering that they can do through Zoom. Sometimes they do FaceTime. But there are some opportunities. They can call 516-292-1300. That's through the Family and Children's Association in Mineola. If you give them a call and just say that my parents are interested in helping out and possibly doing some volunteering from home. Pre-COVID, we would have my parent attend adult daycare. What can we do now to help them with their socialization? Or again, you can access the Family Association, and maybe they can have some seniors that are volunteering, give them a call and just talk over the phone, or maybe do some Zooms. But without a medical daycare or social daycare, it is a big, big, big problem for the seniors, and the isolation is not getting any better. So hopefully things will start to open up again soon. My mom's house is just too big and not conducive to aging in place because of the number of stairs. What can we do? And should we sell or make modifications? And how do we afford to make modifications, as it's our only asset is the house? I can say that I was in a similar situation with my mother-in-law. She had a very large split-level house in Massapequa, and she was 86 years old. So we had to make the decision, was it time for her to leave that home and sell and move on? Or does she stay in her home, and we would have to make those modifications? We ended up selling the house, and she moved into senior housing, and it was the best decision that we made for her. She was able to have her friends and be on a level that she was able to access and maintain herself in the home, and she lived there until she was 95. So I do believe that's a personal decision, but the modifications in the house in a split-level home for us was just too enormous for us to afford. So selling the house sometimes is the only option. We can't afford around-the-clock care for my parents, so what options do I have? Unfortunately, round-the-clock care is something that is very expensive to pay for, so your options would be to apply for community Medicaid, which is something that a lot of people don't realize. They think that they're not going to qualify, and then the Medicaid would help provide some of those services in the home. If that's a route that you're not able to take, then the best thing to possibly think about is assisted livings. There are a lot of assisted livings in the vicinity, and there are people that will help find you the best assisted living based on your income and location. My parent is challenging us about giving up their car keys even though they honestly shouldn't be driving. What can I do? This actually comes up in our practice regularly. It is probably the hardest thing to do is take those keys away from your loved one, because that is the last bit of independence that they have. So sometimes families will call their doctor, and the doctor will tell them that they can no longer drive, or they simply do something and they disable the car. I've had people actually say the car was stolen. Probably not the best idea, but that actually it does work. But that is probably the hardest decision that you'd have to make. I'm concerned about the lack of transportation options if I'm at work. Are there free, affordable options? They are not. There is Accessoride that anybody can qualify for. They can give us a call here and we can help them set that application up. The Accessoride will take them to doctor's appointments and to appointments in the local area, or of course all you have is Uber or Lyft. But unfortunately there is no free ride sharing for elderly at this time. So that's all the questions that we have today. If you have any questions that you'd like me to read on the air, you can email them to info@allthingshomecare.org. So coming up after the break, we're going to speak to Gwen O'Shea. She is president and CEO of the Community Development Corporation of Long Island. We'll be right back. Welcome back to the Dana and Dr. Pearl Show. We're continuing our conversation on low-income senior housing and reverse mortgages. We continue with our guest, Gwen O'Shea. She is president and CEO of the Community Development Corporation of Long Island. So reverse mortgages. Who is your typical client in a reverse mortgage?
Sure. So normally it's a senior, and usually it's either an individual that has been on their own for a long time and is really struggling financially. You know, as we talked about in the earlier segment, the increased costs in terms of living on Long Island. If you're dealing with or managing with Social Security or a limited pension and every other cost is going up, it's just not sustainable. You can't take care of yourself from a health and safety perspective. So individuals will reach out to us, or family members, you know, that have concerns about how to best support their parent or their parents that they want to keep in their home, in the community that they know, because we know there's so much benefit that comes, in particular as you age, aging in place and being comfortable and safe in your surroundings.
Listen, I did a startup care because of being a nurse, you know, sometimes I step in and I help. So we went to go see this patient. They lived in their house probably 70 years in New Hyde Park. And when I walked through the door, you know, you get reminded of how important it is for these people to stay home. The gentleman's 87 years old, demented, but he's sitting in his lounge chair that he probably sat for 30, 40 years with his cat on his lap, and happy as could be. And his wife was happy that he's there too. But we didn't get into finances, but they do need extra help in the house. They do need extra hours. I don't know if Medicaid's going to provide that for them, but there are ways to access funding and money in order to maintain them home and maintain that safely. So if someone has a question about reverse mortgages, or what do? They contact?
They should definitely call us, and they can go on our website. Again, that's www.cdcli.org. They can call us, 631-471-1215. We have trained, certified counselors that are there to help support individuals and family and maintain home. And it's really important for people to know that we're not the lender on the home. We don't have the mortgage. There's no interest here except, again, keeping people financially and house safe. And so we sit down with individuals and we look at their situation, their finances, their needs, property taxes. There's a whole budget process that's taken into place. And we're regulated by HUD because, as you know, after 2007, 2008, so many people were taken advantage of. There were mortgages that were given that really shouldn't have been given to people. There were predatory, you know, reverse mortgage companies. We know that many seniors get scared because there are so many scammers out there. You know, there's so many people calling you on your cell phone, coming to your door, leaving stuff in your mailbox. But we're here to be objective and safe and not tell anybody what they should do or how they should do it, but just really equip people with the best information in a non-emergency situation too. And that's another piece that's really key, is that coming and talking to us doesn't tie you to anything, doesn't mean you're gonna do anything at all. It just means you have more information to think about and plan for the future of how to support yourself or your parents.
Are you getting a lot more calls now because of the tax increases that are going on throughout mostly Nassau County? Do you find that people are like scared about the tax? I know I'm scared. You know, that there's this increase in the taxes. Everybody's being reassessed on their homes and stuff. So I'm assuming that there's going to be a lot more questions or concerns about how to stay at home.
We are starting to see an uptick in calls again, unfortunately, not just related to reverse mortgages, but also to foreclosures. You know, prior to COVID, we were still in Nassau and Suffolk counties, still seeing foreclosure numbers as a holdover from 2007 and 2008. You know, we had some of the worst foreclosure numbers in New York State across the board. And so we are starting to see people call, which is a good thing. And we're hoping that more people, and that's why I really appreciate you having me today, to have people know that they can call us. We are a safe, confidential place. So even if a senior doesn't want to tell their kids that they're calling us, or kids, you know, want to just get an understanding of how they can provide the information to their parents, we're here to, like I said, make people and homes and communities safe and financially stable.
So I think one of the things that I would have a question of, I guess, being in the home care arena, we deal with a lot of people on the private side, but mostly Medicaid. So if somebody has a home, they transferred the house out of there. I'm going to test your knowledge now, because this is a scenario that comes up for us every day. The house was transferred. They have community Medicaid, so the asset of the home technically is not the patient. It's whoever they entrusted it to. How do you talk to the families to help them understand that although the home is technically theirs, but if the individual has 5 hours through Medicaid, but they're requesting 10, you know, somewhere along the line, New York State can't afford to give everybody every hour that they think that they're entitled to, and they do need to access it, and they don't have the money in the bank to pay for it or afford it. How do you broach the conversation with the families that, you know, it's time to maybe look at the safety of your loved one and start utilizing the asset of the house to help offset some of the payment of the care?
So what I would say, maybe an introduction there would be, clearly you're here talking to us because you care about your parents. And clearly, in caring about your parents, what's included in that is their health and safety, which also includes their financial stability and their home stability. And so we'd like to talk with you about how certain options may be beneficial to ensure those aspects for your parent for however long they may be here with us. And so we can talk about how a reverse mortgage may play a role in, again, supporting that ongoing safety and overall health for your parents while they're here with us.
Is there a number, a dollar amount per month that they're able to extract from the house? Is it based on the assessed value of the house, or if they, I guess, can they get a reverse mortgage if they have a mortgage? Like, how does that work?
So every situation is different. You know, I always strongly encourage, and, you know, oftentimes, in conversations, all of a sudden you may learn some additional information. Maybe someone didn't say they took some equity out of the home. Maybe someone didn't say there's another mortgage. So working with our team, again, is really the best start to navigating, because it brings all the information that's necessary to assess, to your question, what does that monthly payment look like based on all of the different scenarios that pertain to that specific property.
So something else that is coming up is what is a weatherization assistance program? There's something else that you guys help people with?
Sure. So shifting gears a little bit into other ways in which we can make sure that seniors are living in a safe space is by using our weatherization program. So CDCLI has been running the program through New York State's Office of Housing and Community Renewal for decades now, and we're very proud of the work that we do. We've helped thousands of households here on Long Island, many of which are seniors, really look at energy efficiencies and some small improvements to maintain their home, keep it safe, and also keep the cost down. As we talked about, increase in utility bills is one of the many challenges that seniors face. And so we're ready and able to go on site. Again, want to make sure that people know that we manage the appropriate, you know, COVID social distancing when going on site and doing those rehab and those energy efficiency efforts. But we're here to help seniors do that.
And so one more time, how do they access you? The phone number and the website one more time.
Sure. Interested individuals should call us at 631-471-1215 or access a lot of this information, more of it, on our website at www.cdcli.org.
That's perfect. Thank you, Gwen. I really do appreciate your time. That's it for our show today. Let's stay connected. Follow us on Facebook and Instagram. To learn more about these topics, visit our website at allthingshomecare.org. See you next time on the Dana and Dr. Pearl Show.
All Things Home Care elevates and supports home health caregivers by providing transportation and promoting education to better care for homebound seniors and the disabled. To find out more or to make a donation, visit us at allthingshomecare.org.